but I also am a client of my own practice. So I'm going to show you some of my own pictures from my hair restoration process, which was very exciting. And now with that little fun story out of the way, let us get rolling. So I'm going to explain what NeoGraft is. For those of you who don't know it, it is a procedure that is done in the office under local anesthesia, where we take your hair from the back of your scalp, back here, and we transplant it from an area of great density to areas of lower density. It's as simple as that. It's your own hair. As this slide will show you, it's done a week. There are no linear scars that are noticeable afterwards. Very high take rate in the mid to high 90 percentile rate with a quick recovery and natural results. So pretty much, if you are a candidate, it's the best procedure out there for hair restoration. It is as simple as that. Of course, it's nuanced. There's a lot of details that make you a good or a poor candidate, things that you should do to optimize your results, but it really is as simple as that. Let me show you this little picture here. On the left, you're going to see the men's hair loss scale, and on the right, you're going to see women's hair loss scale, because male pattern hair loss and female pattern hair loss is different. But if you look to the top left, you'll see number 1. That's basically a pre-adolescent hairline, a perfect hairline with no recession in the temples, or an early mature hairline. And as we progress down, you'll see the temples will march backwards, the frontal hairline comes back, and then if you go all the way to the bottom right, 7, so if you think about somebody who is a 7, that's somebody who has very little hair, just that strip of hair in the back. So that is not a good person for transplantation. There's too much hair lost and not enough donor hair. It's very simply, we have to use the hair that we have in the back to cover areas that are lost. And that goes with any kind of hair transplantation procedure, but this is no different. And women are a little different. You'll see they usually start with a widened part and just becomes wider and wider with a preserved frontal hairline. There are subtypes of female hair loss that you do lose the frontal hairline, and we can of course address those. If you look at this 1 by 1 centimeter square microscopic view of the scalp, this is a normal scalp, an area of normal density if you were to look at it. Now of course the hair has been trimmed so we could see this, but I want you to see how close the hairs are spaced and how most of these follicles have 2 and 3 hairs. Now if we look at somebody who's thinning in an area, it will look like this. If you notice, the hair shafts have gotten thinner and farther apart. And so that's what we're trying to correct. We're trying to get from here back to here. And so what I'm going to show you now is the comparison between the old method, the strip method on the left here. You'll see this nasty scar, so I don't do that procedure. It's painful. You generally need some sort of a sedation or general anesthesia, versus NeoGraft, where you'll see just this patch of red a couple days later, and then the hair grows back in and there are no noticeable scars. So it's a much nicer procedure in that regard. And you know, we often get questions about other areas. So can we do eyebrows? Yes, you can do eyebrows. Can you do chest? Sure. That's not as common, but you certainly can. But most commonly, we're going to redefine the hairline. We're going to, additional volume and thickness will be added. And what I always say is, really, it's never too early to start talking about this. Even if you're not a candidate for transplantation, we really should try to halt the loss, stop that loss. And there are some good therapies that will do that. But we're not going to get too much into alternative therapies today. What you need to know is that NeoGraft is an automated follicular unit extraction device. Think of it like a tiny little apple corer that's going to precisely go around each individual hair shaft and gently cut it and then remove it. And that's what makes this so much better than all the other techniques where you're using a manual technique and then pulling the hair out, which can traumatize the follicle. So, of course, it is dependent on the person doing the procedure, but still you're going to be much better with this automated system than a manual system. This is a close-up view of somebody having the procedure done, and what you're looking at is the NeoGraft handpiece with the little blade, and as you see next to it, there's a little hole where a follicle has been removed. I'm going to show you a couple of pictures from my own procedure and a couple of videos so you can see, and starts with marking. So here I am, and I had some temple recession and some thinning in the top of the head, the vertex. So we mark out the hairline, and you can see the purple line represents where that hairline is going to be. On one side, my left side, it had come back a little bit more than the right. So we filled this entire area in. So once the area is numb with local anesthesia, we use a needle to make holes, and those holes correspond to where the new hairs are going to be transplanted. So the angulation is of the utmost importance, and to make a random pattern so it looks natural, because a natural hairline is random. And then I'll show you a video of me actually getting the procedure done. This is the extraction phase. I don't feel any discomfort. I am just laying down as if I'm getting a massage, and the follicles are being removed one at a time. The follicles then reside in a petri dish. I'm sorry it's a little bit blurry, but they're sitting in a petri dish where we then bathe them with PRP, platelet-rich plasma, which we'll talk more about in the future. And then in this picture here, you see me actually getting the hairs grafted back in, which is just a very tedious, meticulous process of taking individual follicles and placing them where we want them. And here's a picture of me just sitting there watching TV. It's pretty relaxing, actually, for a few hours just to put your feet up and have the procedure done. When we're done, you see I have a hair band on just to keep my bandage on the back of my head. The follicles are in place. There's no bleeding, there's no oozing. They are just stuck in place, and I'm going to be very delicate the next few days so they don't get disturbed. This is what it looks like the next day. Now, I don't have patients remove their bandages the next day because I don't want you to have to see this or deal with it. But I just want to show you, full disclosure, what it looks like. It may look scary to you, but I can assure you it didn't hurt, and I was unaware that there was anything wrong with the back of my scalp. I gently washed my scalp, and it really wasn't a problem. And then 2 days later, you can see the hair has pretty much grown back into the level of a crew cut, and you can't see the extraction sites. So really within 2 days, the donor site looks back to normal. This was a picture of me before and then at 10 months. And I know it's not very dramatic because I didn't have a lot of hair loss, but if you look carefully in the temples, you'll see that my hairline has been brought down and just looks a little bit more mature, or rather a little bit more juvenile afterwards. So those temples are down a little bit and I look a little bit younger. And then here's a picture I took for fun today. Before the procedure, I've let my hair grow out quite a bit. I have curly hair, but definitely a very nice hairline. I'm happy with it at my age, and I hope to continue to have that hairline for years to come. A couple more before and afters just to show you before we finish up. Here's an example of a female frontal hairline that was just getting thin and recessing. So we just put a few hundred grafts in to fix that part, just to show you something very different than what I had. Here's the picture of a gentleman's top of the scalp to show you what global thinning looks like, and then after transplantation can be quite dramatic. Side view there. So what you're going to notice is it just looks natural, it just looks great. Another example of a posterior hairline with a vertex where we have some thinning and then we have better coverage. Let's see, what else can I show you? Here's another female who had some significant hair loss in the top of her scalp. We could have done more grafts, but this was all she wanted, just to get some coverage so she felt good about how she could style her hair. Here's a gentleman who had almost complete loss of his frontal hairline and loss of the hair on the top of the scalp, but he had very much preserved donor site area. So here he is after his first procedure, which was enough to cover. Let me move my picture here. I'll move my icon so you can see his scalp a little better. That's better. You don't need to see me. There we go. That's better. So yeah, we can see that he's had a much fuller hairline there, a better definition, and can style his hair. And what a difference it makes, especially for men, when we lose our frontal hairline. It makes us look older, and that's not always a good thing. And then this gentleman came back, and we filled in the back of his head. So here he was after the first, where we were able to do the front of his scalp, but we didn't have enough donor site to do the back. And then we came back and filled in the back. So that's a pretty good overview of NeoGraft. If there are any questions about the procedure, this is a great time to ask me. I'm happy to answer them for you. If anybody is wondering if the procedure is right for them and they want to come in for a consultation, I would love to see you in person. What I will say for people who are watching now or who may watch it this week, we always like to incentivize people and do something nice for joining me and watching these Facebook Lives. So if you call in between now and Friday and schedule a consult and mention that you watched this NeoGraft Facebook Live presentation, we're going to offer 20% off if you eventually schedule a procedure, which is really pretty awesome. So all you got to do is just pay attention, share this with your friends who might be interested, and I love the procedure, so I'm happy to offer the discount. I'm happy to get people done. I believe in the procedure myself. I've had it done. Family members have had it done. Just very, very happy to offer it. So if anybody else has questions, now would be a great time to ask. And if not, I will say thank you very much for joining me, and I look forward to seeing you again next month when we do another Facebook Live on another plastic surgery topic. So thanks, everybody, and have a great day.